So thank you all so much for being here with us today. We are so excited to be able to bring you this amazing opportunity to hear from a family and hear from experts in the field when it comes to infant loss and bereavement. So thank you to those of us that are joining us today. A huge thank you to our panel members for being here with us today. We are so excited about this opportunity. My name is Vicki Lehman, and I'm the Community Engagement Specialist at Child Care Answers. Child Care Answers is the local child care resource and referral agency. We serve Hamilton, Hendricks, and Marion counties. We work with families to help them find childcare, connect to additional resources, lots of other amazing things, including workshops. And so we are happy to have y'all with us today. We are so excited to have Jamie Lassane Spears and Corey Spears, the Spears family, here with us. They are kind of representing the family side of things. And I'm sure Jamie will also mention that she's our family engagement specialist. So all of the amazing family services I just told you about, Jamie's your girl. And then we also have Lauren Duncan, who is the program coordinator at the Milk Bank with us today, Taylor O'Hearn with Taylor O'Hearn Counseling. And then we have Matt Lewis, who is a neonatologist at Community Hospital North, and also an assistant professor of clinical pediatrics at IU School of Medicine. So those will be our 4 panel members today. We'll have lots of discussion with them. So Jamie or Corey, whoever, or both, tell us about Read and your journey.
Yeah, so we struggled with infertility for a while, and we ended up doing IVF and got pregnant with a boy. And at our 20-week ultrasound, we discovered that he had a congenital diaphragmatic hernia, which is basically, if you haven't heard of that, because I had not, it is his diaphragm wasn't fully developed, and a lot of his organs in his stomach were up in his chest cavity, and it was monitored throughout my entire pregnancy. But we found out pretty shortly after that his case was pretty severe. Most babies with CDH only have about a 50% chance of survival, and I'm sure Matt knows more about that too. But yeah, it was a journey for sure. In the words of Vicki, she always says it's a journey. It was a journey. Just going through IVF and then figuring out that we're having a son, and then finding out that he has a medical condition that can take his life was overwhelming, scary, exciting because we were having a son, and a lot of the feelings. I struggled a lot. I'm usually a glass half empty type of person, and Corey's always a glass half full. And so he guided us a lot with hope, and having hope for that part of our journey. I saw 50%, and then his chance of survival went down to 20% after about 32 weeks. And so I, obviously saw 80% not making it. And Corey always held on to that 20%. And it gave me a lot of hope and a lot of celebration and opportunities to celebrate during my pregnancy. But then he was born, and it was an adventure. We knew straight from the second he was born, he'd be in the NICU, and we knew he would need surgery. And he was put on life support that same day. So about 5 hours after surgery, he went straight into life support on ECMO, and stayed on ECMO about 15 days. And he had about 5 surgeries in his little life. The NICU, we can share more about that too, but it was hard. It was a roller coaster. He was at Riley Children's, and I was at Methodist for the first 2 to 3 days, and we were separated, and Corey was like a ping pong ball bouncing back and forth. I don't know, do you want to share anything about all of that?
Yeah, it was it was a lot to be the kind of, you feel in that situation when Jamie is separated from Reed. You feel a responsibility. You feel that you have this responsibility to make sure that everybody's taken care of. I took on the role of just making sure that I was with Reed. When he went to Riley, I soon, not long after that, I went over there, and I was in the room while they were getting him set up, and I was updating Jamie on everything. And in that kind of situation, you just kind of you dig into something that you didn't know you had. You know, before that, I never would have thought that I would be able to handle a situation like that, but you kind of find it within yourself, the ability to just kind of step up to the plate. So yeah, that's kind of what I would say about that experience.
Yeah, you learn quickly. I think a lot of people have a tendency to say, like, I couldn't go through that. I couldn't do that. But you do, and you can, because you have to. You don't have a choice. And so it was a process that going through the NICU stay. And then, you know, our story ended with infant loss. Reed passed away 17 days later, which is all part of our journey and his story. I don't know, Vicki, do you want to ask the other question, or we can go ahead and talk more about like what that looked like?
Yeah, I can ask the other question. Before I ask the other question, I just want to thank you both so much for sharing your story and sharing Reed. So, I mean, I know you personally, Jamie, and I feel like I know Reed because I know you and because you have shared so much about him, and your story is so powerful. And I just think that you both are such strong human beings, and I know that sometimes it's okay to not be strong too. And so I just think that it's incredible that you keep his memory alive and you talk about him and you share about him. And I just am so grateful that you are both willing to be here and you're willing to share, you know, and keep his memory alive. So I'll ask the next question, but I just wanted to thank you both so much for being here and sharing that story. And I'm trying really hard to keep it together. And so I'll ask the next question. Corey, so this one is specifically for you. What was your experience supporting Jamie through pregnancy, delivery, and loss while navigating your own grief? I know you kind of touched on that a little bit, but it was probably a little bit different since she was carrying him, and you know, you kind of both knew this. And so what did that look like for you from a partner perspective?
Yeah, from, you know, during pregnancy, I felt that role of providing hope, that, you know, I was that person that was always, you know, optimistic. And I think you need a little bit of that optimism because, you know, in our situation, we didn't get a whole lot of optimism. You know, every now and again, you know, you might get a little glimmer of it. But for the most part, Reed's diagnosis and his situation was pretty grim. So supporting Jamie in being that optimistic partner in telling her, you know, hey, this is what the doctor is telling us. But, you know, here's what, you know, we believe together. Here's how we can get through it together. This is the kind of steps that we can take, her and I, to kind of grow closer with each other, enjoy the time that we had with Reed, both during pregnancy and the 17 days that he was in the NICU. And then, of course, I shared my story, you know, about the delivery. Like I said, I just kind of found something within myself that I didn't know I had, and just taking that responsibility to be there both for Reed and being there for Jamie as well. And then in the grief stages, you know, one thing that's really important, I think, for you know, husbands and partners to understand is that, you know, I understood that she was hurting, and I understood that she would be hurting on some level, probably, you know, forever, because of the loss. And I knew that would never go away for her. So understanding that, you know, the just kind of the emotions that come with it, all of the struggles with, you know, communication, relationship, just going back to understanding that she is hurting just like you are. I'm just probably hurting on a whole different level. I knew for Jamie specifically because, you know, the mother carrying Reed and her hurt was different from mine in that way. You know, when we would have those times of just like really big grief, and, you know, if, you know, Jamie just needed to kind of let it out, I would just sit there, I would listen to her, I would affirm her, you know, and then hold her, or then, you know, give her a bowl of ice cream afterwards, or whatever it is that she needed. But also in that, you're dealing with your own grief. I was with my own grief as the husband, and one thing I tried not to do was to, you know, be the strong one that didn't show that grief, you know, be that rock, because
I needed to hear that.
yeah, absolutely. She needed to hear that from me. You know, I needed to process my own grief, whatever that looked like. And so I would talk to her about what my grief looked like. And in turn, that would help her as well. So just making sure that you process your own grief and not try to hold things down. And then also finding somebody, you know, outside of, you know, the marriage or relationship, that will listen to you, that you can talk to, that will empathize with you, that kind of thing. So, you know, I had a friend of mine that I would constantly be communicating with, or had other friends that I would get drinks with, or, you know, whatever the situation might be. But it's kind of like, yeah, that's my experience from the, you know, pregnancy, delivery, and grief side of things.
And I wasn't always receptive to his positive attitude, but it always was comforting in the end. And, you know, you just learn it's not easy on a marriage or relationship to go through this. And I sometimes will have days still where my anxiety is really high and I'm like barking orders, or, you know, just not being the best wife or person in general. And it comes back to, and as I unwrap things, I'm like, oh, it's because I saw this, and this reminded me of Reed earlier. And I think you know, just processing through it, and you just puts you in a different emotional state. And so we've been really good about trying to like get to those kind of moments, so we can talk through it and move forward and be there for each other, I think.
Mm-hmm.
So
thank you both. I'm sure, like you said, Jamie, I'm sure there are things even today that you see or that you experience and you realize like, oh, wow, that's kind of a trigger. And I didn't even think it would be. And so I think that, and Corey, like you said, knowing that on some level that hurt's going to be there for forever. It might look different and it might change shapes, but that it's, you know, a piece of that story. And so, yeah, I have like goosebumps over here. So Jamie and Corey, we have 2 more questions for y'all. Are you guys good with the next 2 questions? Okay, awesome. So this one, and I know that you guys do a lot of things. How did you celebrate Reed and his life during pregnancy? And then how do you celebrate Reed and his life now?
I think, you know, well, during pregnancy, I think Corey talked about it a little bit, and I wanted to say too, we had time. In a lot of ways, we were blessed to have the diagnosis early because we had time to grieve a little bit during pregnancy as well as during the NICU and after, just different stages of grief and different levels of grief. Anyone who has an at-risk pregnancy probably can relate to that grief or that anxiety that comes with that. And so, I mean, we started celebrating in pregnancy. We knew he would be in the NICU for either a little bit of time or a very long bit of time. They told us to prepare for 6 months plus or a couple weeks. And so we had no clue what to expect after he was born. So we still had a baby shower, but instead of like getting clothing, we asked specifically not to get clothes and just get like the bare essentials, like to make sure we did have a room in case, you know, he was coming home. And then we also, like I didn't open any of the presents at my baby shower because I didn't know what emotion it would bring up. I didn't know if I would be sad or excited or what have you. So we just celebrated with friends at our baby showers, his life and who he is at that moment. And then I think that's the biggest way we celebrate during pregnancy, is just holding on to that he's still going to be born and there's a chance we could bring him home. And so we did that. And that worked out well for me, and everyone's different. And for Corey, I think, I don't know if there's anything specific that would have helped differently or done just in the pregnancy stage. No,
I don't think so, honestly.
Yeah, I think that was great. And then like in the NICU, that was really hard. I think that's like an understatement. They told us that with CDH, it's a roller coaster and everything changes all the time. And I didn't understand that until I was like, got in there. And, like from one minute we're worrying about whether or not he's going to the bathroom, to the next minute, whether or not his heart's functioning, to his lungs, to like, and everything was just like, you conquer this one little thing. I didn't know you could be so excited for a baby to poop. And I mean, anyone who's had children probably has experienced that in the first couple of weeks of the baby's life, but like, especially when your baby's in the NICU, I was so excited for that, and their first bowel movement, and we celebrated it.
You really get, and when you're in the NICU, those little wins become
really
huge.
Big ones. Yeah. And so we decided, I don't know where I got this idea from. I think it was just out of pure desperation to find goodness in the moment. Also, I think I knew at some level that this was going to be really hard. We decided to make a star for each day, and I have a couple of them, but each day we wrote a star of something positive that happened, like a milestone we'd reached. And so like his first one was the day he was born. And then like for his surgery, because he had a big repair surgery, which was very long. So like I made a little star for that, and it says like, you were brave for surgery. But then, there was harder days where we didn't have much. So we took a selfie together, and I just said we took our first selfie and tried to make it like have family moments in there. There was one moment where I was just thinking like of all the things I wish I could share with him. And this was after we found out he was probably not going to make it. And my nurse just encouraged us to share it with him. Just like, sorry, I didn't know I was going to get emotional. Like how we met and who we are as people, and just to whisper it in his ear, because we couldn't hold him at this point. We weren't able to hold him until he was off of life support. And so there's just a lot of things that we did that were very special in that way. And I mean, the child life is amazing. They supported us through that journey, and our family and friends did too. And after he passed away, our family came. We had our pastor there, and it wasn't it was hard, but they gave us a little bear. And so we were able to walk out of the hospital holding the bear. And that was hard. Probably the hardest thing I've experienced. But at the same time, I think your grief has a way of helping you get through those really hard moments too. And we're here today. We celebrate him. He would be 4 in January, so 5 in 2022. And we celebrated his birthday with family and friends. We have a memorial brick in Noblesville for him. There's an Angel of Hope garden there if you've lost children, pregnancies, children of any ages. And so we have a brick there for him that we go visit. I write a lot about him for blogs. I've written a post for Childcare Answers. I mean, Corey likes Legos and imagines playing Legos with him. And so like for Christmas, we got like a Lego train and he built it. And like, we just talk about Reed while watching the Lego train go around the Christmas tree. They're little things, but they mean a lot to us. So, I don't know.
Thank you both. So the last question for you. So you recently became parents to the cutest little girl. And so my question for you is, What was it like going through pregnancy after loss?
So it was hard. I feel like I wish I had better words. I think, I wrote this in the blog, and it just like is so true. Like, love isn't always happy and grief isn't always sad. And so I think for me, like, there's a lot of grief in being pregnant again, a lot of fear for that 20-week appointment, a lot of fear for delivery. When I was delivering Freya, which is our girl, like, there are things about my birth with Reed that I didn't even know about. Like, apparently, like, I hemorrhaged or something, and I didn't even know because I was so wrapped up in like what was happening to Reed. And there's just stuff that comes up out of the woodwork that you just don't even recognize was there before. But I have really great friends. I talked to really great people. Actually, Taylor was a good support for me as well, and she'll share more about what she does. But just having people to talk to about it and to say that this is hard. I think Corey was a big support, obviously. I don't know, was there anything for you that was different?
Just personally, each milestone in the pregnancy with Freya, each milestone that you came to, each month that we came to, there's always some kind of comparison to like, what were we feeling at this point with Reed as opposed to what we were feeling at that point with Freya. But then also in those moments, just being thankful, that we do have the blessing of Freya, but we also have those memories of Reed that we'll be able to share with Freya.
Mm-hmm.
She'll always know her big brother Reed. So
Yeah, I guess we can end there. But yeah, we're very thankful that we're able to have a rainbow. So
yeah, and your rainbow is so cute.
Thank you.
So, and I think I just am so grateful that you all were both willing to be here today and willing to share your story. Thank you both so much. And I know for sure that Freya will absolutely know her big brother. And so she's got a big brother out there looking out for her, and she is a lucky little girl for sure. So Lauren, thank you so much for being here. And my first question for you is, how do you all support grieving moms that are donating milk, and how do you support them when it comes to lactation?
Sure. So, we have a program here. It's called Garrett's Gift and the Giving Tree. And it's a sweet memorial that we offer to all of our families who are donating milk after a loss. And if you walk into the front door of our office, you'll see this beautiful tree on the wall full of little golden leaves. And each leaf has a baby's name and birthday engraved on it, just as a sweet memorial to them and their life. And when it comes to donating milk in a baby's memory, it can just be such a powerful thing for grieving families to participate in. As a NICU mom, Jamie, I'm not sure if you had to follow a rigorous pumping schedule or anything like that, but these moms with the NICU babies, they put a lot of time, they put a lot of effort. Pumping is their job. And even if it's just to get those drops for that baby, and we don't want that milk, mom to have to go through the pain of throwing that milk away. She's worked so hard for it. And so we offer an option to donate it to help babies similar to her baby who are in the NICU, oftentimes, very, premature or, have very serious health complications, much like Reed. And, just as a way to let her baby live on in other kiddos and hopefully give them a chance for survival.
So thank you, Lauren. And then as a follow-up to that, so what does that process look like? How do those moms donate the milk? What are the benefits for mom? And I know you just talked about, being able to, have baby live on and, using the milk for other babies that are struggling and different things like that. But just anything else you would want to share, or, how moms go through that process, kind of what that looks like, because I'm sure in that moment for a mom, it is very emotional. And so what does kind of that support look like for that mom, and how do they go about that?
Sure. So, we will accept milk from any bereaved mom. The milk bank, we do operate on some pretty strict guidelines when it comes to milk donation for NICU distribution. We just have to be so careful when it comes to, medications and such, and how they could potentially negatively affect these fragile NICU babies. However, if a bereaved mom does not meet guidelines for whatever reason, we can accept her milk for research purposes. So, and still in the end, help affect the outcomes of fragile babies. If mom wants to donate, what she has to do is she can either give us a call or visit our website to complete just a very brief screening survey. And then she just needs to fill out some forms online that we'll send her. She may or may not need to get a blood test, depending on if she meets the criteria for hospital distribution, and then she can donate. And for the bereaved mom, there is no minimum whatsoever on the amount. So if she has a little sandwich baggie full of 1 milliliter syringes to donate, we'll take it. There's absolutely no limit. We want it to be a healing thing for mom. We want her to know that all of those hours of pumping are not, to go to waste. And, something that I always try to stress when I meet with people in the healthcare field is that you always want to offer milk donation, but you also need to realize, especially for like lactation people, that milk donation may not be right for everyone. It can be extremely emotional. It's a part of you that you are giving away, something that you had made for your baby. And some women, it's too much. And, we need to realize that that's okay, but that we need to give the opportunity to mom to experience this, feeling of empowerment when so many things can be kind of feel out of control in situations, especially if it's a sudden loss. We just need to offer it more than anything. And when it comes to the benefits, of course, the feeling of empowerment, this and that, but there's also physiological benefits of continuing to pump, to let your body heal and get your hormones back to pre-pregnancy levels, and produce the feelings of like oxytocin, which can help moms feel better. It may not solve everything, but it can certainly help. And we don't want mom to have a well-meaning friend or family member say, you know what, just bind your breasts, you'll be fine. Put some cabbage in your bra, you'll be fine. And then 3 days later, mom ends up extremely engorged with mastitis, and she's going to a memorial service for her baby where everyone is going to want to hug her. So we need to be sensitive to these moms and realize that it's not just milk, it's not just pumping, it's a complex cycle, and we can't just stop it. And because that's not serving most moms. well. Some moms need to, and absolutely we understand that, but there are just so many benefits, the physical benefits, the emotional benefits to donating.
Thank you so much, Lauren. And like you said, I'm sure it's a very sensitive topic, and I'm sure it's very individual to each mom. But being able to offer those moms who do want to take part in something like that, being able to offer them that outlet so that they do feel that empowerment. I am sure that, you know, in a world where so many things have felt like they were out of your control, that is something you feel like you can control, even though sometimes, you know, breastfeeding and lactation is a whole other deal. But being able to have that and feel empowered as a mom that has lost a child, I am sure is very, very powerful. So I think that's incredible. And the work you all are doing is amazing. So thank you so much for being here.
Thank you. Oh, it's my pleasure.
So next we are going to move on to Matt Lewis, who is a neonatologist with Community North Hospital. Matt, thank you so much for being here. I'm really excited to get your perspective. So, you know, we've heard Jamie's story, but then thinking about from the medical standpoint of things, how the hospital supports those families that are making those medical decisions for their newborns that they never thought that they would ever have to make. Or even making medical decisions before the baby has even been born. Like, this is going to be our plan once baby arrives. So what does that look like? What kind of support and what does that look like at the hospital level?
Great question. And thanks for the invitation to allow me to be here. And thank you, Corey and Jamie, for being here as well and sharing your story. Grief is so hard for, I think one of the biggest things to realize and for others to realize is grief is so hard for family and friends to understand, and especially grieving that continues for several months. You know, a pregnancy loss can be one of the most painful and traumatic times that anyone will ever experience in their lifetime. And there's no real right way to grieve. How parents cope with loss is very individualized. We at the Community North, and I'm part of the bigger IU group as well. At Community North specifically, we have a couple services in place, and one is we're one of the only hospitals that has a psychologist in the NICU and in the OB department. And so she's a PhD psychologist who sits with families and helps talk through processes, helps talk through grieving, helps with supports before a baby's born, after a baby's born, after a loss. Invaluable to the group, and it's not something that's seen at a lot of hospitals. And so I think we're really fortunate, at least in the community system, to have our PhD psychologist. We have the Open Arms support system. It extends support to families who experience a pregnancy or newborn loss. It's a free program that offers many different services, and all the Open Arms services are actually coordinated by a grief support person. So these folks are specifically trained to offer support to grieving parents. They're either staff or volunteers, and they help by listening, comforting, providing resources and advice. There's actually a parent support group that meets every third Thursday of the month, or every month. There's telephone support services and additional support services. So those are some of the things we have in place. There's also an Angel Wings fund through the Community Health Network Foundation that helps families who've experienced a stillborn or newborn loss. And it's actually a fund that helps defray some of the costs of funeral and burial services. So lots of different supports in place that hopefully can help families through this.
I think that's incredible. I think having a psychologist on staff that can sit down with these families that are, you know, dealing with these things that, you know, somebody who is expecting a baby, they're expecting a baby and everything's going to be great. And that's just how life works. And so these individuals who are put into a situation that they are having to make decisions and think through things that they never thought they would have to think through. I think that's such an incredible resource to be able to have, and those supports to be able to say, you know, this is happening, but here's how we're going to rally around you and help you. And so then, you know, they aren't feeling like they're all alone on an island by themselves, because I'm sure it can feel very isolating. So my next question for you kind of is a follow-up, just in general, how can a pregnant or a new mom advocate for themselves and their baby? So, you know, being aware of what questions to ask, and what things to be aware of, and what kind of does that process look like? Especially, you know, there are a lot of first-time moms out there that just kind of roll with it and do what the doctors say you're supposed to do, and that's the right thing to do. But then how do you make sure that you're advocating for yourself and advocating for your kiddo before they even make it into the world, or once they are a newborn?
Yeah, another great question. Every experience is individualized, right? And so just realize that it's really important to be your own voice, and to be your own medical voice. A couple of the things that from Jamie and Corey's story that stood out, Corey's optimism through the process. You know, so as you're going through this, surround yourself with your people. You know, you need a mix of folks on every optimistic level. If you have that, make sure. And another important thing, and again, Jamie and Corey kind of reminded me how important this is it's not there are multiple people in this scenario that are either grieving or experiencing loss, and I think sometimes there's a lot of hospital attention on the mom, and I don't see a lot of times before a baby's born, but on the NICU side I see this where the mom is the focus and the dad is sort of in the corner, and Corey had mentioned the must be strong issue. It's really important for everybody to realize that it's a group thing, and it's that everybody needs supports. And so as far as advocating, just be your own voice. I know families are doing research into things. Jamie and Corey had a lot of time to learn about congenital diaphragmatic hernia, but even other things that can come up. You mentioned the first time mom versus maybe experienced moms too, and I think it's so true. With experience comes sort of an understanding that nothing is 100% in medicine, and so just remembering that, and keeping an open mind with everything.
Vicki, can I tag on to that real quick?
Absolutely.
Yeah, I think that you brought up some things too that came to mind as I'm thinking through my experience. And, there are a lot of well-intentioned people at the hospital. And if you work at the hospital, I know how much you've done and what you're doing. And you have the child life, you have the chaplain services, you have the doctors and the physician assistants and then the nurses, which are, you have everyone there. But I think, part of it as a family, I had to learn when I needed to stop services as well, in the sense of, for me, because everyone would come in and be like, how can I help you? What do you need? Here's this service, here's this service, here's this service. And, I just gave birth yesterday, and I don't know, and I think, just being able to say that and to have people be in your corner too. At one point I told the nurse, can we just not have any extra people into the room for the next couple hours? Because I just need, so she blocked child life and chaplain services, just because for that minute, I couldn't handle more than just what I was taking in myself that day. And so I think advocating for yourself, if you're feeling that, just say that to somebody, and they'll help you by either cutting off supports or giving you the support you need. Or at least that was my experience, or ours.
Yeah.
Yeah, and I think what Matt said, that every family is going to be totally different, right? So like one family is going to be like, give me all the things, give me all the supports. And then another family is going to be like, I need none of you to talk to me because I'm just trying to like deal with some things in my mind right now. But I think it's so nice to know, right? Like you said, Jamie, you knew like these are the things that are options to us, and people are coming in and they're asking me, but I need some time to just like figure things out in my mind before I can tell you what I need from you. I can't tell you what I need from you because I don't know. And so I think, like Matt said, being that advocate, right? Because at the end of the day, you have to be your own advocate, and doing the research and knowing your stuff and being able to say, hey, I saw this. Is this legit? Is this not something that we should be thinking about? But then also, like as a parent, you are the number one advocate for your child. And so, you know, you're advocating for them before they're even born. And so being able to kind of have that connection and knowing there are supports here, there are all of these amazing supports here for me, and I can tap into them if I need to. But right now, I just need to figure out what's best for me, and then we can go from there. And so, Matt, I appreciate you touching on the fact that every family is completely different, because it is not a one size fits all. And every family is going to kind of navigate the process in a different way. So thank you so much, Matt, for being here. So we have Taylor O'Hearn, who is a licensed mental health counselor. And we are super excited to have Taylor here with us today. Taylor, thank you so much for being here. And my first question for you would be, from the mental health side of things, what do you recommend for women and families in general, right? Because like Matt said, it's a lot of times it's the mom, but like Corey mentioned, like you don't have to be a hero, right? Like you're a dad and you're going through a grief process on your own. So what do you recommend for women and families that have experienced loss at any point during their pregnancy or after?
Yeah, so I was thinking about this question, and the thing that we've been talking about all along, that everybody's different. So what's so hard is that it would be, I mean, I would love nothing more than to be able to give some sort of like really magical answer to this. But I really think that the magic is in acknowledging that you are also different. So being able to acknowledge that nobody's grief looks the same, that comparing your grief to somebody else's grief is not going to be probably fruitful for you. So figuring out, what is it that I need? And I know that Jamie and Corey talked about this, and I was able to witness and have been able to witness with other moms and dads that, you know, what Corey was saying about grief being like a lifelong thing. I find myself having conversations with women and parents that sort of compare grief to like a raging river. Like sometimes it's rapids and it is, you know, scary and turbulent, and you feel like it's just going to pull you right under. And other times it might be sort of a placid, beautiful place to sit and reflect and to remember. And so I think knowing that both of those feelings are normal, both of those feelings will probably ebb and flow, and giving yourself the space to say, okay, what is it that I'm up against today? Like, is today a raging rapid day, or is today a placid stream? Do I need a life jacket, or do I need like a cruise ship to navigate these crazy things? So being able to identify and break it down to, what is it that I need today? Like Jamie was saying, like it might not be that you need all those services today. Another day, you really might want somebody to talk to. So being able to give yourself some space and leave things open to identify, okay, this is where I am right now. This is what I need. This is what would be helpful. I definitely think therapy is a great opportunity for that, whether that is individual or couple or both. I think for some folks, they are probably blessed with really wonderful, listening, empathic friends, and that might be what they need. But I think not everybody has that type of support, and not every well-meaning friend is really able to sit with something this painful. And so I do think having somebody who you don't have to take care of their feelings, you don't have to worry about them feeling sad because you're feeling sad, having somebody that can be there for that purpose is really helpful and meaningful. And then find your people. So I think Matt had said, being able to kind of find the people, they may not be the people that you usually turn to, and that's okay. It's okay to disappoint people if the people need to shift a little during this season, but figuring out, who are my support people? Are they therapists? Are they, you know, things that are going on from the community, resources. Are they friends? Is there somebody that has been through the situation before that I can reach out to? That figuring out what group of people you need, I think, is also really helpful.
That's all such great advice. And I think, yeah, I think that's like the underlying theme to today is everybody's different. And so everybody's different. What everybody needs is different. But Taylor, I've heard that they say grief comes in waves. And so sometimes you're just cruising and then it'll hit you and something either triggered you or some thought crossed your mind. And then you have to, right, you need the cruise ship. Which I mean is okay because cruise ships usually have pretty good food, so it's probably okay. But I think that being mindful of what people need, and I think also, like you said, not worrying about like, oh, I'm going to hurt this person's feelings if I don't confide in them or if I don't talk to them. It's not about other people. It's about what you need in that moment. And so I think that's, being able to even tell somebody that like, it's okay. Like, it's totally okay for you to say, I don't want anybody else to come in this room, or I don't want to talk to my best friend about this. I want to talk to this person that I haven't talked to in 3 years about this, because I think they'll get it more. And so I just think that that's great. And then my next question for you is just some common coping strategies. And so I know we talked about the, starting your day, is it going to be a raging river or more like placid, clear water? But just some common coping strategies, resources that you might find helpful when a family is beginning that healing process. And I guess really they're beginning that healing process, but they're truly continuing to heal for a really long time. And so kind of what does that look like?
Yeah, so what's great is there is actually an organization that I as a provider did my extra perinatal training through called Postpartum Support International. A lot of that is birthed right out of Indiana, out of IU Health. And so what's really cool is that if you go to their website, which is postpartum.net, they have support groups. They have support groups for loss during pregnancy. They have support groups for infant loss. They have support groups for parents, for fathers, for mothers. I mean, so many different types of online and virtual support you can get. There's also a provider directory that you can get on and find counselors or therapists that have had additional training in perinatal mental health that might be able to help you navigate better. There's also even like, there's tools for people that are allies, people who want to support their friends who've gone through a loss. There's a discussion guide that they've printed up there about like, this is something you could just hand to your friends to say, hey, this is really hard for me when you say this, or, hey, I really wish you would ask me this question. So it's done some of the legwork. And I feel like, honestly, because of the diverse nature of everybody's experience, having something like that is really helpful. There's a hotline if there's an emergency on that website, but also every region has a care coordinator. So if you're looking at that and going, I don't even know what I need. Like I need some help. I need some services, but I don't know what that is. There's a care coordinator you can find on the website. They can actually sit with you, listen to you, and help you figure out, okay, what would be helpful for this day, for this juncture where we are. So I think that's probably the best resource that I could share.
Sounds like an incredible resource. So thank you so much for sharing. So thank you, Taylor. And then our last question, and y'all don't have to, all the panel members don't have to answer this if you don't want to, or if you feel like we've already covered it, but just anything else when it comes to, so this is a question for everybody, panel member wise, how can an individual support a grieving family? So just a basic, somebody has, in their family, or they're talking to, or they're connected with somebody who is grieving the loss of a child, a loss of their newborn, loss before pregnancy loss. How can somebody support that individual?
I also have experienced infant loss as well. That's why I do what I do. And I think just in personal experience is to be present. And I know that we've all touched on it, that the grief journey is different and it can ebb and flow. And your friend or your family member may have really great days and may have really low, hard days, and to give them grace and to just be there for them, and just be present more than anything. just be there for them.
Thank you so much for sharing that, Lauren.
I think for me and for us, and I said this earlier, I didn't know what I needed at all. I still don't know to this day at times what I need. And I think, instead of asking, how are you, what do you need, and just trying to get that person to express themselves, just like Lauren said, be there. In the days and the weeks that followed, I mean, there are some days that food would just show up at our door and I was like, great, this is awesome. Or like someone would text me like, we're bringing you dinner tonight. Do you want Chipotle or Chick-fil-A? Like, it's just like, when that was my biggest choice of the day, it was so nice. People always ask about like what kind of gifts to give because they want to do something. I received my most meaningful gifts were jewelry with his name on it, or initials. I think, again, gift cards to food because we couldn't process food, our own food intake, or like navigating the grocery store after loss is like a whole other like thing. And so it's just, there's just getting back in the real world was hard. And also, I think it's been said, but there's a lot of well-intentioned things that people think they're saying. Just stop and think, I think, is the biggest thing before you say something. And just take a minute and put yourself in that person's shoes. And what you want might not be what they want. So listen and stop and think. And I think those are my biggest tips, I think, for families, just being there. And yeah, anything for you?
No, that's good.
Okay, nothing.
I think you might have like somebody who's like, if I were in this situation, I would want somebody to come over and clean my kitchen and vacuum the floors and da 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 da. And then somebody who's the complete opposite and is like, please don't come in my house. Like, please, we do not want anybody over here right now. We just want to be alone. And so I think, like you said, Jamie, like being there, but also not getting hurt feelings if somebody says, no, thank you. Like, no, thank you. I mean, I don't think lots of people would turn down Chick-fil-A, but, like, no, thank you to coming over and sweeping my floor. And, I don't want to go have coffee with you and sit down and talk to you about this right now, but tomorrow that might be all I want to do. And so, being there for somebody through the waves as it ebbs and flows and understanding that it's not personal. If they this isn't about you. This is about somebody else and what they need and what's going to be best for them.
I think just remembering the timeline, the meal trains and things that are set up, sometimes last a couple of weeks and then they taper off, and that's not how grief works necessarily in a lot of individuals. And so keep checking in, 1 month, 2 months, 6 months, a year, 2 years, just remembering that it's someone's going to get a lot of supports early on, and then remember to be there as it's tapering.
That's a great reminder. That is a really great reminder that it's not once you forget about it, doesn't mean that those people have forgotten about it or not forget about it. But, like once that's moved on to the back of your mind, does not mean that that is not still very fresh for those individuals.
Yeah, bouncing off of that to anniversaries. So any sort of traumatic event, anniversaries, milestones, seeing a kid that's that age, like it can come up at any time. So I think trying to be thoughtful. One of the things that I had to learn as a person is that, if someone's already experiencing grief, their grief's not going to be compounded by you asking about it, right? They're already experiencing it. They're already thinking about it. And so if you do notice it's an anniversary, or if you do feel like, hey, this is an important time, send the text. And also then, like you said, be okay if they don't want to respond to you. Be okay if they can't respond to you. But just go ahead and say the thing that you need to say, because it does matter that you're still thinking about it, even if it's not something that they want to talk about at that time.
Thank you so much. Go ahead, Jamie. Go ahead.
I was just gonna say, whenever I get a message that someone was thinking about him today, like it just comes out of the blue, but it, you know, we have our symbolisms for him. Like we associate the blackbird with Reed for the Beatles song and et cetera, et cetera. And so anytime like someone like takes a picture of a blackbird and said, I heard the song and saw a blackbird and it was a moment, it, you know, it brings joy to our hearts to like know that, you know, it's just something as simple as that, and that they are not expecting any follow-up. Because I don't necessarily want to talk about my feelings in regards to that, but I so appreciate, and it fills my heart when you do send me those messages. So, yeah.
That's awesome. Thank you all so much for sharing. We do have a few questions in the chat. I think the first one is for you, Matt. And so somebody had just asked if we can get information about open arms and any grieving materials. So I guess this really open arms and then any grieving materials and in general, or any other services available. And then they also mentioned we need to consider different cultures and how they deal with the loss, which is totally accurate. It is going to be person by person, culture by culture, very unique to whoever that individual is, what their background is.
There's a phone number for actually each of the hospitals, but also there's a bibliography as well. The bibliography, it's essentially for bereaved parents, adult books, children's books, it's sort of all spectrum that Open Arms has accumulated.
Thank you, Taylor. And then the next question is, would you recommend counseling as a general rule for couples who have experienced pregnancy loss?
I don't like to recommend anything as a general rule, but I would say that, as I think Jamie and Corey both stated, that you know, when you're navigating grief, it is both two individual journeys as well as a change for the relationship as a whole, as far as the dynamics of the relationship, what's happening with roles in the relationship. So yeah, I think any resource you can get to help navigate within your relationship, help you be able to notice and honor how someone else is grieving. Sometimes we communicate with our feelings, like Jamie, I think, mentioned, you know, like just shouting off commands or something. So sometimes having another party to be able to point that out and say, oh, hey, I wonder if that's anxiety, can help, versus, you know, sometimes when we're already in our own stuff, we might hear that and go, oh, they're attacking me. I didn't, you know, and we get into our own feelings. So I think that it's absolutely helpful to find a skilled, you know, couples clinician who has experience in this area to help navigate through that. Yeah.
Awesome. Thank you so much. And then we have a question for Matt. As a medical professional, how do you navigate providing medical information or something that's matter of fact to a family while also respecting their feelings, their grief, all that comes with hearing that news?
Great question, Lauren. Thanks. It's a balance. I mean, it's funny that I think a lot of you learn this over time, that even matter of fact things in the medical world, there's so much gray, and like I said earlier, nothing is 100% in medicine, and so just kind of balancing. I mean, there are facts, there are stats, there's data, but at the same time, a lot of my counseling is prenatal counseling during prematurity and babies who are born at 23 and 24 and 25 weeks gestation, and there's data that's accumulated, nationwide data about outcomes, but it's really important to remember that every baby is one individual baby, and so it's a balance about giving facts and sort of giving data, but also being very respectful of how difficult it is, and how difficult a lot of the news is, and how difficult the grief is. And it's really important to respect feelings and kind of balance all that.
And I'm sure it's hard for a family that wants the straight, like, just tell me, like, what is going to happen here? I need 100% sure answer. I am one of those people. And so I am sure it is really hard when you are interacting with somebody and they're like, okay, but really, and you're like, okay, but really, there is no 100% guarantee here because there just can't be. I'm sure that is really hard for a lot of people while they're, grieving or thinking through something else or dealing with a new diagnosis. And at the same time, it's like, we can tell you what we think is going to happen based on the statistics, but your baby is a human, like it's a person, and every person's very different and unique. So I can imagine that that's a very tricky thing to kind of navigate with people.
And numbers kind of stick with folks too. I mean, Jamie and Corey, Jamie, I read your post on the organizational website. You're 1 in 8 and 1 in 2,500 and 1 in 2. And so there's optimism and pessimism. It's a mix of everything with all that. So I just being very careful and very respectful of feelings. It's so important.
Thank you so much, Matt. Do you have any resources for people whose babies have not been born, either due to it dying in utero or having to terminate because of a severe medical diagnosis? Most of the discussion seems to be around losing babies that weren't born, not that that is any less painful.
I can pipe in. I would just say that at that same link that I shared when I was talking about those individual support groups, there are actually, I believe when I was looking last night, there is a support group specifically for medical termination for those sorts of decisions and difficult things that people have had to navigate. And I think that early miscarriage, those types of things as well, there's also specific support. And I would say, just to tag on to that and to hear, I think, the heart of that question, I sit with a lot of moms who have comparative grief around their miscarriages based on what week they were on. So I think it's really important to be able to acknowledge that any loss is a loss, and to be able to understand that it might affect different people differently. But while some of these conversations have been maybe directed around babies that were birthed in one way or another, that I think all these things still apply. I mean, the river came from working with someone who lost a baby at 7 weeks. So I think that it's important to understand that these things don't diminish based on the time you had with that baby in utero, if that makes sense.
And to tag off of that, I think, I don't have great resources. Unfortunately, I don't think I found the great resources for me when I was pregnant with Reed. But we were given the option of termination. And when we found out his diagnosis, because it was severe, and, we chose to have Reed and to see where his little life would take because of what Matt said, because every baby is different. And that's what we chose as a family. But I do think too, there's so much for even like families, we had a failed IVF, for instance, and there's so much hope that you put in before you even get pregnant a lot of times. And so just to echo off of what Taylor said, just to encourage those families that their loss is a loss. And even if it was at 2 weeks, because people with IVF know at 2 weeks whether or not they're pregnant or not, to just encourage that, to encourage them to seek help or to go to counseling for that, because it's not, like everyone's saying, it's not as easy as this step, or this experience equals this. So.
And yeah, Christine, great question. I do want to clarify that the Open Arms program that I was talking about, and then the bibliography for grieving parents, it's pregnancy loss as well. Very inclusive with all that.
And I just wanted to chime in as well that we do oftentimes work with moms who have experienced, stillbirth, or have had to, make that very difficult decision to terminate a pregnancy due to, severe diagnoses. And, we honor any loss, whether mom delivered a living baby or not. A loss is a loss. And it doesn't matter. Taylor said, she worked with someone who experienced loss at 7 weeks. That is a loss. Again, a loss is a loss, and it can be just as traumatic, losing that 7-week pregnancy, or losing, a baby who was born living, and it was a sudden loss. And we want to honor all of them.
Thank you all so much. And Taylor, I think what you said is very true, that people will compare, right? Like, oh, well, it could have been like this though. So like maybe that person shouldn't be so sad, or, whatever it is. But like you all said, a loss is a loss. And and the more that people have that support and understanding, I think the better. So we heard about so many amazing resources today, and I am so impressed with the work that is being done for families and for these littlest kiddos, and to make sure that we set up families to, feel comforted and supported, and offer as many resources as we can. And so I thank all of our panel members so much for being here with us today. Jamie and Corey, thank you so much for being here and sharing your story. Like I said, I feel like I know Reed because I know you. So I definitely am so thankful that you all were here and that you were willing to share Reed and your story. And then thank you to the rest of the panel members for being here, sharing your resources, sharing your expertise. This is going to be such an amazing support and resource for us to be able to share with the community.